Welcome back, everyone, to another deep dive. Today, we're going to be talking about an issue that's really, really important for India's public health, and that's the fight against tuberculosis, TB. And it's an area where we're seeing some really impressive progress, but also some persistent challenges, too. And, understanding this whole picture is super important, especially if you're trying to stay up to date on India's progress and their policies and how things are developing.
Yeah, absolutely. I think in today's world, we're just bombarded with so much information, especially about health issues, that it can be really hard to figure out, what are the truly important developments? What are the things we should be paying attention to? So the goal of today's deep dive is really to try to distill, those key insights. And we're going to be looking specifically at a recent article from the Hindu, to kind of guide us through that. And we really want to get a clear understanding of, what progress has been made, what are the major changes that have happened, and, the way that TB is approached in India. And crucially, we want to look at what are those remaining obstacles, in India's ambition to completely eliminate TB. So it's like we're
Yeah.
trying to cut through the noise and get to the core of what you really need to know.
Yeah, absolutely. And this article from the Hindu, it really does a great job of laying out the current state of TB care in India. And it points to some really remarkable progress in a number of areas. So I'm really curious to dig into this with you. Where have we seen some of the most impactful changes in a positive way in India's fight against TB?
Well, I think one of the foundational areas where we've seen huge progress is in how we actually identify TB cases. For the longest time, the kind of standard method was this thing called sputum smear microscopy, and while it served a purpose, it often led to these delays in diagnoses, and it also wasn't sensitive enough to catch every single case.
Right. So that first step, actually getting a proper diagnosis, that's
Mhm.
obviously super critical. So what's changed that's made that diagnosis piece more effective now?
The real game changer has been the adoption of these molecular testing platforms, and specifically I'm talking about CBNet and TrueNet. And what's really remarkable about these tests is just the sheer improvement in speed and accuracy. I mean, these tests can detect TB in just a matter of hours, and what's even more important is they can also pinpoint those drug-resistant strains right off the bat.
Wow. So just to clarify for folks who might not be familiar with these testing methods, what exactly makes them so much better than the older microscopy approach?
Sure. So basically, these newer tests, they work by directly identifying the unique genetic material of the TB bacteria, from a patient's sputum sample,
Yeah.
right? And so this is much more sensitive and much faster than just trying to look for the bacteria under a microscope like they did in the past.
Okay, that makes sense. So it's like a more targeted approach. We're actually looking for the DNA fingerprint of the TB bacteria, so to speak.
Yeah, exactly. Yeah, and that's why it's so much more reliable and quicker, and that early identification of drug resistance, that's absolutely crucial when it comes to managing TB.
Right. And why is that so crucial? This ability to know right away if someone has a drug-resistant strain of TB.
Well, it all comes down to being able to start the right treatment right away. In the past, a patient might be put on a standard treatment regimen for weeks or even months, only to find out later that it's not actually effective against the strain of TB they have, and that allows the disease to progress. It can get much worse, and it also increases the risk of spreading it to other people. So these molecular tests, they essentially give doctors a roadmap to the correct treatment much, much earlier in the process.
Yeah, it makes total sense. Time is of the essence, right, when you're dealing with any kind of infectious disease. So so you've got this amazing technology now that could really speed up diagnosis, but
Yeah.
it's not enough just to have the technology, right? It's also got to be accessible to people all across the country.
Yeah. Yeah, that's exactly right. I mean, what good is a cutting edge test if people can't actually get to it? So the government has really stepped up its efforts to make these molecular testing labs available in every single district across India, including those in rural and remote areas.
So it's not just an urban phenomenon anymore. Everyone's got access to this.
That's the goal. And as you can imagine, having these tests available so widely, it means that rapid, accurate detection, it's not just limited to big cities anymore, and that faster diagnosis that has a ripple effect. It leads to faster treatment initiation, which, as we said before, helps to cut down on transmission within communities. And of course, it massively improves the individual's chances of recovery and survival.
Yeah, I mean, it all kind of makes sense when you think about it, but it's great to see that these advances are actually being implemented on the ground. Now the article also talks about some major strides in the treatment of TB itself. If we've moved away from those really long and difficult drug regimens, haven't we?
Yeah, we definitely have. And this is another area where where I think the progress has been really encouraging. There's those traditional TB treatments. They could last for 6 months or even up to 2 years and involve taking multiple medications every single day. And you can imagine that that was a huge burden on patients. It really impacted their quality of life. And understandably, it also led to pretty high rates of people dropping out of treatment before it was finished.
Yeah, I mean, taking medication every day for 2 years, that's a huge commitment. So what are some of the challenges that those long treatment regimens posed, besides just the burden on the patient themselves?
Well, one of the biggest issues was that it actually contributed to the development of drug resistance.
Mm.
When people don't complete their full course of treatment, it gives the TB bacteria a chance to mutate and become resistant to those drugs, and that obviously makes it much harder to treat TB effectively in the future.
So what's the more effective approach that's being used now?
Well, one of the most exciting developments in recent years has been the introduction of this all-oral regimen called BPaLM, and it's been a real game changer, especially for people with multi-drug resistant TB, or MDR TB as it's known.
So MDR TB, that's the really tough kind to treat, right?
That's right. And what's so remarkable about BPaLM is that it's much, much shorter than the previous treatments. I mean, we're talking about 6 months compared to 18 to 24 months, so it's a huge difference.
That's a pretty dramatic reduction in the treatment time. So what makes this new BPaLM regimen so much easier for patients to handle?
Well, there are a few key factors. I mean, first of all, it's all oral, which means you don't need any of those painful injections that they used to have to give. And those injections were not only unpleasant, but they also carried the risk of some pretty serious side effects like hearing loss.
Oh, wow. So not having to deal with injections,
Yeah.
that's a huge plus.
Yeah, absolutely. And then, of course, the shorter duration of treatment. That just makes a world of difference.
Mhm.
It's so much easier to stick with a 6-month treatment plan than a 2-year treatment plan.
Right. It just feels more manageable. You can see the light at the end of the tunnel.
Exactly. And because people are more likely to complete the full course of treatment with BPaLM, it means that there are lower rates of treatment failure and also less risk of the TB bacteria developing resistance to the drugs.
So it's a win-win on multiple levels, and it's just better for the patient overall. Both physically and ethically, right?
Mhm.
It's got to be less stressful to be on a shorter course of treatment.
Oh, absolutely. Yeah, there's less disruption to their lives. They can get back to their normal routines much sooner, and yeah, the psychological burden is significantly reduced.
So we've talked about diagnosis, we talked about treatment now. The article also talks about how important nutrition is in the fight against TB. And I think sometimes people forget about that aspect. They think it's all about medication, but nutrition plays a huge role too, doesn't it?
It really does. Malnutrition is actually a major risk factor for developing TB in the first place. If your body is weak and your immune system is compromised, you're much more susceptible to the disease. And then even if you do get diagnosed and start treatment, if you're not getting the right nutrients, your body is going to have a much harder time fighting off the infection and recovering. So it's this kind of vicious cycle. Malnutrition increases your risk of getting TB, and then it makes it harder to recover from it.
Right. So what's being done to address that nutritional aspect?
Yeah.
To make sure that people who are battling TB are also getting the nourishment that they need to recover.
Well, the government has recognized this issue, and they've actually stepped up their efforts to support TB patients nutritionally through a program called the Nikshay Poshan Yojana, or NPY. And this program provides direct financial assistance to TB patients specifically to help them afford nutritious food.
Oh, that's great. So how much support do they get through this program?
Well, initially the monthly amount was 500 rupees, but they've recently increased it to 1,000 rupees per patient, and that money is directly deposited into the patient's bank account.
Okay, so it's not like they're getting vouchers or anything. It's just straight up cash they can use to buy whatever food they need.
Exactly, and that's really important because it gives people the flexibility to choose the foods that are most appropriate for their cultural preferences and their dietary needs. It's not a one-size-fits-all kind of thing.
Yeah, that makes sense. So how has this MPY program impacted, TB treatment outcomes?
Well, I mean, the results have been really encouraging. When people have access to good nutrition, it strengthens their immune system, it helps them recover faster, and perhaps most importantly, it reduces the chances of them dropping out of treatment, because they're not feeling as weak or as sick. So there's definitely a strong correlation between good nutrition and higher treatment success rates.
And it probably also just helps people feel better mentally, right? I mean, if you're battling a serious illness like TB, being well nourished is probably going to improve your mood and your outlook as well.
Oh, absolutely. Yeah. I mean, it's hard to stay positive when you're when you're feeling weak and run down. So yeah, good nutrition definitely has a positive impact on people's mental health as well.
So we've covered diagnosis, we've covered treatment, we talked about nutrition, and now there's another really interesting development that the Hindu article highlights, and that's the integration of TB services into the Ayushman Bharat scheme. So can you tell us a little bit about why this is so significant?
Yeah, sure. So traditionally, TB control programs like the National Tuberculosis Elimination Program or NTP, they often operated kind of separately from the mainstream healthcare system. It was kind of like a siloed approach, and while those dedicated programs achieved a lot, this separation sometimes created gaps in accessibility and coordination of care. It wasn't always easy for people to navigate the system and get the services they needed in a timely manner. So the idea behind integrating TB services into the Ayushman Bharat framework is to bridge those gaps, to make it much easier for people to access TB care as part of their regular healthcare experience.
So it's like streamlining the process and making it more patient-centered. Yeah.
Exactly. And one of the key elements of this integration is the role of Ayushman Aroja Mandirs, or AMs, and these are basically these strengthened primary healthcare centers that have been set up all across India, and they now serve as designated sputum collection points. So people in the community can just go to their local AAM to get tested for TB. It's really convenient, and it makes it much easier to catch cases early on.
Okay, so it's bringing TB testing closer to the people, so to speak.
Exactly. And another important aspect is that patients who are diagnosed with TB at bigger hospitals, like tertiary care hospitals, they can now often receive their ongoing treatment and follow-up care at their local AAM, so they don't have to travel long distances to those big hospitals every time they need a checkup or a refill of their medication.
Oh, wow. So that must be a huge relief for patients, especially those who live in rural areas.
Yeah.
They don't have to spend time and money traveling back and forth to the city.
Yeah, absolutely. It makes a big difference. And it also helps to reduce the dropout rate, because people are more likely to stick with their treatment if it's convenient and accessible. And it's not just about the physical access. Community health officers are now being trained to monitor patients who are in the early stages of TB treatment and to recognize any signs or symptoms that might indicate, a need for more intensive care so they can refer those patients to a hospital in a timely manner.
Okay. So it's like having a safety net in the community so people don't fall through the cracks.
That's a good way to put it. Yeah. And ultimately, this whole integration effort is about creating a much more seamless and patient-centered approach to TB care. It's about making sure that people can get the services they need at the most local level possible and removing any financial or logistical barriers that might prevent them from seeking care.
Yeah, it sounds like a really positive step towards a more holistic approach to TB care. Now, the article also talks about the really important role that the community plays in this fight. And I think sometimes we forget that, it's not just about doctors and hospitals. It's about the whole community coming together to tackle this issue.
Absolutely. Healthcare is not just about, the clinical aspects. It's about people and communities, and social support is absolutely crucial when it comes to TB, especially because there's still a lot of stigma attached to the disease in many parts of India. And that stigma can prevent people from seeking treatment or from disclosing their diagnosis to others. And that can obviously have a negative impact on their recovery and on the overall efforts to eliminate TB.
So how can communities get involved, in a positive way in the fight against TB?
Well, one of the most powerful things that communities can do is to support TB survivors and help to create a more open and accepting environment where people feel comfortable talking about the disease and seeking help. And there's a really great program that's being implemented in many parts of India called TB Champions. And these are basically TB survivors who have volunteered to share their stories and their experiences with others and to advocate for TB awareness and support.
So it's like a peer-to-peer support network.
Exactly. And it's incredibly effective, because when you hear someone who's actually been through TB talking about their journey, it just makes it so much more real and relatable, and it gives people hope. It shows them that recovery is possible and that they're not alone in this fight. And besides these individual champions, there are also a lot of NGOs and self-help groups and local health workers who are doing amazing work in their communities. They're organizing awareness campaigns, they're providing counseling and support to patients and their families, and they're really working to break down the stigma surrounding TB.
So it sounds like community involvement is really a key piece of the puzzle. It's not something that can be solved by the healthcare system alone.
No, definitely not. It takes a village, as they say, and when communities are engaged and empowered, it makes a huge difference in the fight against TB.
So far, we've talked about all these really positive developments, the advances in diagnosis and treatment, the nutritional support programs, the integration of TB services into the healthcare system, and the role of the community. But the article in the Hindu also makes it clear that there are still some really important challenges that need to be addressed if we want to fully eliminate TB and ensure equitable care for everyone.
Yeah, absolutely. I mean, while the progress has been remarkable, we're not there yet. There's still a lot of work to be done. And I think one of the key takeaways from the article is that we need to shift our focus now to ensuring that the benefits of all these advancements reach every single person who needs them, regardless of their background, their location, or any other vulnerabilities that they might face. It's about making sure that no one is left behind in this fight against TB.
Right. So it's about equity, making sure that everyone has a fair chance at a healthy life. And one of the things that the article highlights is this idea of strengthening person-centered care.
Yeah.
So what does that look like, in the context of TB treatment and prevention?
Well, it essentially means that we need to move away from this kind of one-size-fits-all approach to TB care and really start tailoring our interventions and our support systems to the unique needs and vulnerabilities of different patient populations, So recognizing that a young woman in a rural village might face very different challenges in accessing TB care than, an older man in an urban slum, and really trying to tailor our services to meet those specific needs.
So it's about getting to know the individual patient and understanding their circumstances.
Yeah, exactly. And the article actually points to a really successful example of this kind of targeted approach. It's a program in Tamil Nadu called Kasanoi Aropila Thidam, or TNK-EAT. And this program focuses on proactively identifying and supporting people who are at high risk of developing TB. So people who might be living with HIV or who have diabetes or other conditions that weaken their immune system, and they provide them with a whole package of support, everything from nutritional counseling to housing assistance. And the results have been really impressive. They've seen a significant reduction in mortality rates among these high-risk groups.
That's fantastic. So it's like a preventative approach, trying to stop TB before it even develops in those who are most vulnerable.
Exactly. And the suggestion in the article is that we need to scale up these kinds of targeted interventions, nationwide, and really focus on reaching those most vulnerable populations like tribal communities, migrant workers, people experiencing homelessness, people who often face really significant barriers when it comes to accessing healthcare.
Right. And it makes sense that if we're going to eliminate TB, we can't just focus on the average person. We had really pay attention to those who are most at risk. And the article also talks about the importance of recognizing and addressing what it calls intersectional barriers. Can you explain what those are?
Yeah, sure. So intersectional barriers refer to the way that different social categories, like gender, socioeconomic status, caste, religion, disability, they can all kind of intersect and create these unique and compounded challenges for people when it comes to accessing healthcare. So for example, a woman from a low-income family who also has a disability, she might face multiple layers of disadvantage that make it really difficult for her to get the TB care that she needs. She might not have the financial resources to travel to a clinic, or she might face discrimination from healthcare providers, or she might not even be aware of the services that are available to her.
Wow. So it's like all these different factors kind of piling up on top of each other.
Exactly. And it's important to recognize that these intersectional barriers exist, because if we don't, we're not going to be able to design effective interventions and programs that truly reach everyone who needs them.
So it's about looking beyond just the obvious factors like income or location, and really trying to understand the complex web of social and structural issues that can influence a person's ability to access healthcare.
Exactly. And the article mentions that while the National Tuberculosis Elimination Program has introduced a gender-responsive framework, there's still a lot more work to be done to really understand and address these intersectional vulnerabilities, and that's going to require a lot of research and a lot of collaboration between different stakeholders, the healthcare system, the government, civil society organizations. Everyone needs to be working together to make sure that no one is left behind.
Yeah, it sounds like a really complex issue, but it's also an incredibly important one if we're serious about achieving health equity.
Absolutely. And speaking of integration, the article also talks about the need to To integrate TB care even further into the general healthcare system, going beyond what's already being done through Ayushman Bharat.
And why is that so important?
Yeah.
Why not just keep TB care as a separate kind of specialized service?
Well, one of the main reasons is that TB often doesn't occur in isolation. You know, Many people who develop TB also have other underlying health conditions like COPD or diabetes or mental health issues, and treating TB in a silo,
Yeah.
without considering these other conditions, it's just not going to be very effective. It's like trying to fix a leaky roof without checking the foundation of the house. You need to address the whole picture.
Right. So it's about taking a more holistic approach to healthcare.
Hmm.
Not just treating the disease, but treating the whole person.
Exactly. And the article suggests some really interesting ideas for how we can achieve this kind of integration. For example, using AI-enabled chest x-rays that can screen for both TB and COPD at the same time, or implementing routine testing for non-communicable diseases in all TB patients so that we can identify and manage these coexisting conditions more effectively.
So it's like killing two birds with one stone.
Yeah.
You're getting screened for multiple conditions at the same time, and that can obviously lead to better health outcomes overall.
Absolutely. And it also just makes the whole healthcare experience more efficient and less burdensome for patients. They don't have to go to multiple different clinics or hospitals to get the care they need.
Yeah, that makes a lot of sense. And another really important issue that the article raises is the financial burden that TB can place on patients and their families, even with the support that's provided through the Nikshe Pushan Yojana.
Yeah, while NPY is doing great work in helping people meet their nutritional needs, there are still a lot of other costs associated with TB that can really strain people's finances. Things like transportation costs to and from clinics, lost wages if you're too sick to work, childcare costs if you need someone to look after your kids while you're getting treatment.
Yeah.
All of these things can add up and really create a financial hardship for people who are already struggling.
So it's not just about the direct medical costs, it's about all those indirect costs that can really add up.
Exactly. And the article suggests that we need to think about expanding social protection measures to help people cope with these financial burdens. Things like providing wage loss compensation during treatment or offering livelihood support programs for TB survivors to help them get back on their feet. Because if people are worried about how they're going to pay their bills, they're less likely to stick with their treatment. And that can obviously have negative consequences for their health and for the overall efforts to eliminate TB.
All right, so it's not enough to just provide free treatment.
Right.
You have to also address the social and economic factors that can prevent people from accessing that treatment or from completing their full course of medication.
Exactly. And I think that's one of the key takeaways from this article is that, eliminating TB is not just a medical challenge, it's a social challenge as well.
Yeah, it's a really important point. And then finally, the article also emphasizes the ongoing need to really ramp up public awareness about TB and to work towards reducing the stigma that's still associated with the disease. And I think that's something that we can all play a role in.
Yeah, absolutely. I think there's still a lot of misinformation out there about TB, and that can lead to fear and discrimination and prevent people from seeking help. They might be afraid to tell their family or friends that they have TB, or they might be worried about losing their job or being ostracized from their community. And that's why it's so important to talk openly about TB and, to educate people about the disease and to challenge those harmful stereotypes and misconceptions.
Yeah, and I think one of the things that the COVID-19 pandemic taught us is that public health messaging really matters.
Yeah.
If we can get accurate and clear information out to people, it can make a big difference in their behavior and their health outcomes.
Absolutely. And I think we need to take the same approach with TB. We need to launch these large-scale public awareness campaigns that really target those misconceptions and promote early diagnosis and treatment, because the earlier we catch TB, the easier it is to treat and the less likely it is to spread to others.
So it's like a proactive approach, trying to stop TB in its tracks before it has a chance to really take hold.
Exactly. And I think that's really the key to eliminating TB. It's about prevention as much as it is about treatment.
So it sounds like we've made incredible progress in the fight against TB in India, but we still have a long way to go.
Yeah.
There's still a lot of work to be done to address those remaining challenges and to ensure that everyone has access to quality TB care.
Yeah, I completely agree. I think the progress has been really encouraging, but we can't get complacent. We need to keep pushing forward and really focus on those equity issues, those social determinants of health that we talked about. Because until everyone have a fair chance at a healthy life, we haven't truly succeeded in eliminating TB.
Right. And I think India has a real opportunity here, not only to eliminate TB within its own borders, but also to serve as a model for other countries that are struggling with this disease. If India can demonstrate that it's possible to achieve TB elimination in a country as large and as diverse as India, it would be a huge inspiration to the rest of the world.
Absolutely. I mean, India has already made incredible strides in so many areas of public health, and I think TB elimination is definitely within reach, but it's going to take a concerted effort from everyone, the government, the healthcare system, the civil society communities, individuals, we all have a role to play in this fight.
So just to kind of recap the key takeaways from our deep dive today, we've talked about some truly remarkable advancements in TB diagnosis and treatment, the molecular testing, the BPaLM regimen, the nutritional support through MPY, and the integration of TB services into the Ayushman Bharat scheme. But we've also talked about the importance of addressing those remaining challenges, ensuring equitable access to care, tackling those intersectional barriers, providing financial protection for patients and families, and really ramping up public awareness and stigma reduction. It's a multifaceted challenge, but I think there's a lot of reason to be optimistic.
Yeah, absolutely. I mean, I think India's on the right track, and if we can maintain this momentum and really focus on those equity issues, I think we can achieve TB elimination within our lifetime.
That would be amazing. And I think it's worth pointing out that, this whole topic of TB elimination is not just relevant for public health professionals.
Yeah.
It's something that everyone should be aware of, and it's especially important for those of you who are preparing for competitive examinations like the UPSC. Because this is a topic that touches on so many different aspects of India's development.
Yeah.
Health policy, social justice, economic development. It's all interconnected.
Yeah, absolutely. I mean, understanding India's TB program and the challenges that we face in achieving TB elimination, it's really essential for anyone who wants to have a comprehensive understanding of India's development trajectory.
Absolutely. So as we wrap up our deep dive today, I want to leave you with a bit of a thought-provoking question. Considering all the progress that we've discussed today and all the challenge that remain, what role do you think community-led initiatives, building on the success of those TB champions and local health workers, what role do you think they can play in bridging those gaps and ensuring that everyone has access to quality TB care? It's something to really think about and to discuss with your friends and family, because this is an issue that affects us all.
Yeah, that's a great question. And I think community engagement is going to be absolutely crucial in the final push to eliminate TB. Because ultimately it's communities that are best positioned to understand the needs of their own members and to develop and implement solutions that are culturally appropriate and sustainable. So I think we need to invest in strengthening community organizations and empowering them to take the lead in this fight.
Yeah, I couldn't agree more. And if you're interested in learning more about this topic, we encourage you to check out the article that we've been discussing today. It's from the Hindu newspaper,
Yeah.
and it provides a lot of really great insights and information. And of course, we always love to hear from you. So if you have any questions or comments, please feel free to leave them below, and be sure to like this deep dive and subscribe to our channel for more in-depth discussions on important issues like this.
Thanks for listening, everyone.
We'll see you next time.